Good morning, ladies and gentlemen. I'm Nirpur Janapriya, and you are joining with the Continuous Professional Development Program organized by the Society for Health Research and Innovation. Moving on to housekeeping details. I think most of this was shared with you earlier as well. The session will be recorded, and please be notified by that. And your mics and cameras should be muted, please, for minimal disturbance. The webinar link will be available from 9 a.m. to 9:50 a.m. to join in. No late attendees will be entertained, please, thereafter. Please be notified. Each attendee should have been attended till the end of the webinar to obtain the certificate for CPD points, and CPD points are strictly adhered to National Certificate for Continuous Professional Development Guidelines. This is to improve and maintain the standards of CPD programs conducted by Sri. And thank you for strictly adhering for the CPD regulations and your kind. So, asking questions. Question time will be at the end of the webinar. If you have any questions, please type in the chat box. Please change your chat setting to all panelists and attendees so your questions can be answered. If you have very specific questions about your situation, please email us through this email address, which is office313@gmail.com. Today we'll be joined by Dr. Mithila Ruwange, acting consultant for sports medicine, sports and exercise medicine, led Ridgeway Hospital for Children. And today's topic will be the role of physical activity in preventive and curative medicine and introduction. And over to sir.
Good morning. Welcome to Sri. First of all, I would like to thank Sri for giving me this opportunity to deliver this lecture. Today, we are going to discuss about the role of physical activity in preventive and curative medicine. These will be my topics for today's lecture. We will discuss about the burden of NCD and what healthy life is. What do you mean by physical fitness? How to become physically fit? And what are the components of physical fitness? And we'll see also what are the recommendations. There are several recommendations given by the WHO as well as the American College of Sports Medicine. So we will decide what these recommendations are. And we'll see what we mean by exercise prescription. So these will be my main topics. So before moving on to the main topics, first of all, now you all must have been knowing now NCD or non-communicable diseases. When you take non-communicable diseases, there are two main categories where we can divide. There are things called modifiable risk factors and non-modifiable risk factors. When we take non-modifiable risk factors, it's like our age, our family history, and our race and gender. Those things we cannot modify. Normally, the male gender has a higher prediction, higher chances of developing non-communicable diseases, as well as when we take the factors which can be modifiable risk factors. These again include obesity, physical inactivity, sometimes diabetes, hypertension, those things, and unhealthy food habits. Those things are modifiable risk factors. So genetically, males are more prone to develop non-communicable diseases, as well as a Sri Lankan, normally the alcohol consumption, tobacco consumption is much more in males. So again, the risk factors are more for males to develop non-communicable diseases. And the other one, generally in our families, we know that if we ask from somebody who is more active at home, normally it's the mother or the female who's more active than the male. So again, the risk factor is more, this is a general thing, it's more for males than the females, because normally we think that males are not physically active when compared with females. But statistically, there's a small difference between, there's a controversy between these two. Now we'll see. Now, Sri Lankan Health Ministry, in cooperation with the WHO, has done a survey which is called the STEP survey in Sri Lanka to decide the number of cases in non-communicable diseases in Sri Lanka. So the first one they have done is diabetes. They have done in diabetes in 2015. They have found that every one person out of 14 people, every one person is having diabetes in 2015. But when it comes to 2021, that percentage has gone up to 1 in every 7th person. So the chances of developing diabetes in Sri Lankan population has gone up rapidly. And though genetically and males are more prone to develop non-communicable diseases, according to this study, females are having higher risk of developing diabetes. So why is that? Is there a reason for that? We will see. And when it comes to hypertension also, in 2015, they have found out every 4th person is having diabetes in 2015. And when it comes to 2021, every 3rd person is having hypertension. Again, the risk is more in females, not in males. When it comes to hyperlipidemia, again, in 2015, they have found that every 4th person is having hyperlipidemia. But when it comes to 2021, every other person is having hyperlipidemia. Again, the risk is higher in females. And there's another one which is overweight and obesity also. In 2015, 1 in every 3rd person is having obesity or overweight, and it has not changed in 2021, but the actual percentage has gone up a little. But still, the females are having higher risk than the males. Now, as I said earlier, genetically, males are more prone to develop all these non-communicable diseases. And when you come to when it comes to modifiable risk factors, also males are having higher risk than the females. But when we take the statistics, females are having higher risk of developing these non-communicable diseases. So why is that? I think this is not a proven thing, but I think this can be one of the main reasons. Though we think that the males are physically active than the females are physically active more than the males, statistics say the females are physically inactive than males. So why is it? Why now? Normally we know that in our families, our mother does a lot of work. Comparatively, males or the fathers do less amount of work. But when it comes to statistics, where they have found out what are the physical inactivity, then they have found that females are physically inactive than males. Why is that? In my coming the slides, we will discuss about what the reason can be. This is not a proven thing, but this can be the main reason. And the other alarming thing is that in Sri Lankan's children, they have found every 5th child is physically inactive. Physically inactive, and this is also more in females than in males. So we are heading towards a very, very dangerous future, because whatever the figures that we have now might change in the future dramatically, and the percentages of having non-communicable diseases for children will be very high in future, simply because they are still not physically active. They are not up to the standards of physical activity. And females are more prone to develop these diseases. Then again, when they give birth to children, that risk again goes up. So this is a very alarming thing in Sri Lankan situation, where now the trend is going up, and according to these figures, this might be very dangerous, and this trend will go many folds up in the future also. So we have to prevent that one. So to prevent that one, we definitely will have to increase the amount of physical activity we do as adults as well as children. We will discuss about those things today. Now, first of all, what is health? Now we say that we have to be healthy. Everybody knows that we have to be healthy so that we don't have any kind of diseases. But to be honest, what is healthy? What do you mean by healthy? The WHO has given the definition of, it's not the merely absence of the disease. It's a combination of physical fitness, mental fitness, and social fitness. So to become healthy, we have to have a proper mental health, proper social environment, as well as proper physical fitness. So today my main topic is going to be discussing about this physical fitness. So we will decide what physical fitness is. Again, as normal population, we tend to come to an assumption whether this person is physically fit or not by looking at their external appearances. Now, for instance, now see this picture. There are three people, A, B, and C. A is a very thin person, B is a very muscular person, and C is a very fat person. If I ask from you, who is more physically fit out of these three, I am sure most of you will say that the person in picture B is the one who is physically fit, because he has very good musculature, very good physique compared to the other two. A is like a malnourished person, and a C person is like a overnourished person with a lot of fat. But actually, these people are completely different. The person who was in picture A is Kipochke. He is the marathon world champion. He has won 3 or 4 Olympic gold medals for marathon, and he has the world record for marathon running. So can he be a physically inactive person? Can he be an unfit person? No, that can't be. And the person who is in picture C, he's the Mabangwa. He has, I think, again he has won 3 or 4 times the world sumo wrestling. So can he be a physically unfit person? No, it can't be. The person who is in picture B, I don't know who that person is. He's definitely a model, where he wants to show the other people that he has lot of muscles. But by just looking at a person, it's very difficult for us to say, and we cannot say whether this person is physically fit or not. Though this player in picture C is having huge amount of fat, we cannot see his muscle percentage. He might be having huge number of muscles, but we can't see. And definitely the person in picture A, he is having a good muscle mass comparatively, relatively good muscle mass. He is having a relatively good muscle mass, but definitely he is having high amount of endurance. So by just looking at a person, we definitely can't decide whether he is physically fit or not. It's just their appearance. By just looking at them, what we can see is their, what we say, the body composition. So this is something that I want you to highlight. I want you to have it in your mind, that by just looking at a person, we can't come to a conclusion whether this person is physically fit or not. So what is physical fitness then? How are we going to decide what is the definition of physical fitness? The WHO has not given a proper definition for physical fitness, but American College of Sports Medicine has given a rough idea about what physical fitness is. According to the American College of Sports Medicine, physical fitness is the ability to perform day-to-day activities without any injuries, without any fatigue, and at the end of the day, that person is capable of enjoying his whatever the leisure activities, and he has the capability of meeting unforeseen emergencies in life without any difficulty. This is the definition. So, a physical fit person will be able to perform his normal day-to-day activities without any fatigue or undue injuries, and capable of enjoying his life, enjoys his leisure activities without any injuries. So this is the definition. So if a person is capable of doing his normal activities, suppose that there are two people who has to run for the train. They are late to go to the train, and both of them start running. And suppose that they have about half a kilometer to run. One person is capable of running the whole length, but the other one cannot complete that run. He has to stop in between. Why is that? Because his endurance level has gone down. He is not capable of continuing that activity for a long period. So his physical fitness is less. Endurance level is less. And the other thing, there are two people who wants to lift the same amount of weight. Suppose that both of them are in equal body shape, body compositions. So the person who's physically fit or strong will be able to lift that weight. But the person who's not having enough strength will not be able to lift that weight. Again, we all know that when we get up in the morning and when we dress ourselves to come to work, we have to tie our shoes and we have to put on our socks. If you can't bend down and do that activity without any pain or difficulty, then definitely our flexibility has gone down. That means our physical fitness has gone down. Likewise, if we are capable of performing normal day-to-day activities without any fatigue or difficulty, then you are physically fit. By just looking at a person, we will not be able to come to a conclusion whether this patient, the person is physically fit or not. Then we have to see now, if we are to achieve physical fitness, how are we going to do that? So to achieve physical fitness, there are about several things that we have to do. One thing is we should have a proper nutrition. If we don't have a proper nutrition, if we don't take enough energy, if we don't take a balanced diet, then definitely it will be very difficult for us to become physically fit. So we have to have a proper balanced diet. And we have to do regular physical activities or exercises. Now there are two types of things, exercise and physical activity. So what's the difference between these two? And we have to do either regular exercises or regular physical activity. So in next slide I will discuss about the difference between the physical activity and exercise. So to become physically fit, first thing is that we should make sure that we have proper nutrition. The other thing, we should do a proper amount of physical activity or exercise. The other one is we have to have an adequate rest. After any activities, we should have an adequate rest and proper adequate sleep. Ideally now, for normal adults, what we say is at least 6 hours of sleep is a must. It can vary depending on their physical activities. High-end athlete might need more time to sleep than a normal person. So it can depend according to the physical activity level. And again, we have to have a good hygiene. If we don't think of our hygiene, if we don't have a bath properly, if we don't wash our hands properly, then we are more prone to develop infections. So our physical health or the physical fitness go down. So to become physically fit, these 5 factors has to be there. Proper nutrition, proper amount, adequate amount of exercise or physical activity, adequate amount of rest and sleep, as well as proper hygiene. By doing those things, we can become physically fit. So we will decide what physical activity means, what is exercise means, and what are the recommendations that we should do these exercises or physical activities to become physically fit. So what is the difference between exercise and physical activity? The physical activity is a broad term. Physical activity means if we do any amount of work by using our skeletal muscles and using energy, it is a physical activity. Now I am talking using some amount of muscles, and I am using at least a small amount of energy. This is also physical activity. When I move my hand, when I do any amount of work, it's going to be a physical activity. So when I do any physical activity, my intention or my goal is to make sure that some work is going to be done. My intention is to make sure that work is done. But when it comes to exercises has a different thing. Those are repetitive, rhythmical, and ideally they are planned and structured. But having said that, exercise comes under the broad umbrella of physical activity. Now, our main difference between these two, physical activity and exercise, is our goal. The goal of doing some kind of physical activity is to make sure that work is being done. But when it comes to exercise, our main goal is to make sure that at least one or several components of our physical fitness increases or at least maintain in the same level. So that is the main difference. Now, if I illustrate this in an example, now suppose one person gets up in the morning and goes to the playground to walk for maybe 1 kilometer. We'll suppose that he's walking 1 kilometer, and another person goes to the boutique. Again, that person is also going only 1 kilometer. Both of them are walking at a same speed and same distance. One is doing it in a ground, the other one does it to go to the boutique and buy a loaf of bread. Now, who is doing physical activity and who is doing exercise? Definitely both of them are doing physical activity because they are using their skeletal muscles and using energy and doing some amount of work. But the person who is going to the boutique to buy a loaf of bread, his intention is not to improve his physical fitness. His intention is to make sure that he goes to the boutique and buy a loaf of bread. So he is just doing a physical activity. But the person who's walking around the ground, his intention is to make sure that his physical fitness goes up. So it becomes an exercise. But the person who's going to the boutique, both of them are doing the same activity. But since the intention is different, the person who is going to the boutique is only doing a physical activity. I hope you can understand the difference between the physical activity as well as the exercise. Of course, exercise comes under the broad term of physical activity. Only major difference is the intention. In a person who is doing exercise, he has an intention of becoming physically fit. The person who is doing the physical activity, he might not have the same intention. If the person who is going to the boutique goes to the boutique, walks to the boutique simply because he wants to improve his health also, rather than going in a car, he might go to the boutique, he might walk to the boutique. So he has two intentions, buying a loaf of bread and improving his physical activity. So this again definitely become a physical, the exercise, because he has the intention of improving his physical activity also, physical fitness also. I hope you can understand. Now, as I said initially, there are several components to physical fitness. As I told you, if a person is capable of running to the train for a long period, his endurance is good. If a person is capable of lifting a weight, his strength is good. If a person is capable of bending down and tying his shoelace without any difficulty, his flexibility is good. So, likewise, there are several components of physical fitness. These can be divided into health-related physical fitness and skill-related physical fitness. So, health-related physical fitness, there are five components. Those are cardiorespiratory endurance, muscle endurance, body composition, muscle strength, and flexibility. These are the health-related physical fitness, components of the health-related physical fitness. And the other component, which are the skill-related physical fitness, those are the agility, reaction time, speed, power, coordination, balance. Those are skill-related physical fitnesses. So the main purpose of today is to make sure that our health-related physical fitness are improved. So we will discuss about the cardiorespiratory fitness, endurance, muscle endurance, muscle strength, body composition, and flexibility. Now suppose some person, if somebody comes to you and to improve their physical fitness, you should have an idea which component of his physical fitness is lacking, whether it's endurance or cardiovascular or muscle endurance, whether it's the physical fitness, whether it's the body composition, whether it's the flexibility. Most of the time, a lot of people come to us saying that I want to reduce my fat, I want to become thin. So most of them are worried about their body composition. But when a person comes to you, you have to have an idea whether this person needs cardiorespiratory endurance improvement, whether this person needs muscle endurance improvement, or he needs strength improvement in his strength, or flexibility, or the body composition. So how are we going to do that? Now, if a person wants his cardiovascular endurance or muscle endurance to be improved, then he should be prescribed aerobic exercises. Then only he will be able to improve his endurance levels. And if a person needs an improvement in his strength, then we have to give them resistant exercises. Then his muscle strength will be improved. And for a person to improve his body composition, where he wants to improve his muscle mass and decrease his fat mass, then aerobic as well as strengthening exercise, both of them are very good. And if a person wants to increase his flexibility or the ability to move, ability to bend or do activities, then we have to give him stretching exercises. Every activity, every physical activity as well as exercise might have all these components. Now, by doing aerobic activity, we are mainly targeting cardiorespiratory as well as the muscle endurance. But by doing aerobic activities, they can improve their muscle strength. But our main target is to improve their cardiorespiratory and muscle endurance. It does not mean that by doing aerobic activities, their strength will not improve. Their muscle strength will improve, but to a very lesser amount. Now, same thing in resistance. If a person does a lot of resistant exercises, then his muscle strength will be increased because the strengthening activities or the resistant activities target mainly on muscle strength. But their the endurance levels also will go up. I hope you can understand. And so we'll decide now you know what to do to improve their aerobic endurance level, to improve their strength, to improve their body composition, and improve their flexibility. Now you have a rough idea. So we'll see what WHO and American College of Sports Medicine has given us, the recommendation, what their recommendation is to improve these components. Now they have divided these physical activities or exercise recommendations according to our age groups. But according to them, ideally, children who are under 5 years, between 3 and 5 years, from the time they get up till they go to bed, they should be physically active throughout the day. Whatever they do, it has to be a playful thing for them. It's not that they should go and sit down and study their alphabet. They should be playing throughout the day. If you want to teach them the alphabet, make it a play. Start playing with them. Then they are physically active throughout the day. So this is the recommendation by WHO as well as the American College of Sports Medicine. It's very good for their, not only for their physical fitness, but also their mental growth as well as for the development also. And from 5 years to 17 years, what they recommend is that they should be physically active throughout the day, but at least 60 minutes per day, every day. They should be physically active, and their activity intensity, they have given an intensity saying that this has to be moderate intensity or vigorous intensity. So the WHO recommendation or the ACSM recommendation is that children between the ages of 5 years and 17 years, they should be physically active at least 60 minutes per day in moderate intensity or high intensity. So now the problem comes, what is this intensity? How are we going to decide what intensity we should be doing the exercises? In the next slide I will tell you. And for the children, they say, though they 60 minutes per day in moderate intensity, at least 2 or 3 days they should do vigorous intensity exercises. At least this is not limited. There is no limitation, but at least they should do 2 to 3 days of vigorous intensity activities, exercises or physical activities, and they should also focus on muscle strengthening activities as well during these 2 or 3 days. So this is the recommendation for 5 years to 17-year-old children. Now we'll see what the intensities means. Now when we do physical activities, we can do it in a mild intensity, moderate intensity or high intensity. So there are several ways of measuring whether we are doing our activity in which intensity, to find out which intensity we are doing our physical activities. We can use the VO2 max or the heart rate max or heart rate reserve, and there's another thing called perceived exertion, or we can go for the MET values. Those are very scientific way of deciding what intensities we are working or we are doing any kind of a physical activity. It's good to know about these things, but practically when it comes to day-to-day activities, it might be very difficult for us to measure the intensity by using all these parameters. The easy way is to do it we call it torque test. By using this torque test, anybody can understand what intensity they are doing their physical activities or the exercises. So what is this torque test? Suppose that when you do any activity, any physical activity, if you can sing while doing this physical activity, then you are doing that physical activity or the exercise in mild intensity. While you are doing that activity, you can sing. Now I will go back to my first question to you. We think females, our mother, does lot of activities at home, physical activities at home compared with the father. But when you think mother cooks at home, mother sweeps the compound and the house, but she's while doing all these activities, she's capable of singing. Most of the time, they might be singing while doing those activities. So normally the females do all those activities in mild intensity, not in moderate or high intensities. So that might be the reason why they have higher incidence of NCDs, because they are not doing it in moderate or high intensity. So all the recommendations are there in moderate or high intensity. When we do physical activity, what the recommendation is to do it in moderate or high intensity so that our physical fitness will be improved. But don't have the misunderstanding that if you do physical activities in mild intensity, we will not get any benefits. No, it's not like that. Even if you do in mild intensity, there are a lot of benefits. Rather than doing nothing, doing physical activities in moderate intensity is very, very good. That of course you have to understand. But the recommendation to normal individuals, the recommendation is in moderate intensity or high intensity. So to have the maximum amount of health benefits, we have to do at least moderate to high intensity. Then only we can have the maximum amount of advantages or physical fitness benefits within a short period of time. Otherwise, if you do in mild intensity, the time period that we have to spend is much higher. That might be the reason. I am not saying this is the reason. This is not a proven thing. This is, but I think that this can be. This is one way of seeing why females are having much more diabetes, hypertension, ischemic heart disease in Sri Lanka, because they are doing their activities in mild intensity. Always they are doing it mild intensity. If there's any amount of work that has to be done in moderate intensity or high intensity, it's most of the time males are the one who's doing those physical activities. So that might be a reason why they are having low level of NCDs in Sri Lanka. And as I said in the previous slides, the physical inactivity is more in females in Sri Lanka. Again, the reason can be because they are doing all those activities in mild intensity. Now, I told you about the mild intensity. Now, how are we going to decide whether we are doing these physical activities in moderate intensity? If you are, when you are working or when you are doing any physical activity, you can't sing. But if you are comfortable having a conversation with another person without any difficulty, you can have a conversation with another person, but you are too short of breath to sing. Then you are doing that physical activity in moderate intensity. And while performing that activity, if you find it very difficult to have a normal conversation, you are out of breath to have a normal conversation, then you are doing that activity in high intensities. So this is the easiest way of measuring what intensity we are doing our physical activities, whether this is mild, moderate or high intensity. So the recommendations by WHO as well as the American College of Sports Medicine is that any activity we have to do in moderate or high intensities to have the maximum amount of health benefits within a short period of time. I am again stressing, it does not mean that if you do mild intensity activities, you will not get any health benefits. It's not like that. Even a single mild intensity activity counts to improve your physical health. So even doing mild intensity activities is very good rather than doing nothing. Okay. Now, what are the recommendations by the WHO or the American College of Sports Medicine for adults over the 18 years of age? What they say is at least 150 minutes of moderate or high intensity exercise per week. It has to be throughout the week. Now, if you say the person can be physically fit for 30 minutes for a day and at least 5 days per week, that will be the ideal. Or he can do high intensity activities, only high intensity activities, at least 75 minutes per week. This again has to be throughout the week. If a person has any combination of these two, moderate intensity as well as high intensity activities, a combination where cumulatively it's either 150 minutes per minute in moderate intensity or 75 minutes per week in high intensity, that of course is okay. Now, there can be people whom they don't work, they don't do any kind of a physical activity throughout the week. But when it comes to weekend, they go to a gym or go to a playground and do moderate to high intensity activities maybe for 2 to 3 hours. Then definitely these recommendations are met because this is given for a week. But what the WHO and the ACSM, the American College of Sports Medicine says, if we can do it regularly throughout the week, then the benefits are much more rather than doing it in a single day for the whole week. So it's much more, the benefits are much more if you do it throughout the week rather than at a single stretch. Now, this is for the aerobic activity. This is for the aerobic exercises. Aerobic where your muscle endurance as well as cardiovascular endurance will be improved. But apart from that, what they recommend is at least 2 to 3 days of muscle strengthening activities. This is again not in two consecutive days. Ideally, they should have at least 24-hour gap between the strengthening activities for the same muscle group. Don't get this confused. Now, if you do strengthening activities, upper body strengthening activities today, you can do lower body strengthening activities tomorrow. It doesn't matter because those are two different muscle groups. But for the same muscle group, ideally 24-hour gap has to be there to do the proper strengthening when you do the proper strengthening activities. So the WHO recommendation is, while you are doing aerobic activities throughout the week for at least 150 minutes of moderate intensity activity, it is always better if you can do at least 2 or 3 days muscle strengthening activities, resistant activities to improve your muscle strength. This is for the recommendation for adult over the 18 years. Now, flexibility, balance and coordination recommendation. Now, as I said, body composition will improve by doing either resistant exercises or aerobic exercises. So, if you do at least 5 days a week, moderate intensity activities, 150 minutes, and do 2 to 3 days of resistant activities, then your endurance, the muscle endurance, cardiovascular endurance and muscle strengthening will be improved, as well as your body composition will improve. But what about the flexibility? Will that improve? It's hardly improved. So WHO has recommended that we do at least flexibility exercises, but they have incorporated balance exercises and coordination exercises. Though these are under the category of skill-related physical fitnesses, they have incorporated these balance as well as coordination exercises for all the adults who are above 85. It does not say that people who are below 65 years, old adults mean 65 years, above the 65 years. It does not mean that people who are below 65 years will not have any benefits. So, but their recommendation is at least 2 to 3 days of flexibility, balance, and coordination exercises. So, what normally Tai Chi, I hope you know what Tai Chi means, and sometimes the yoga exercises. These will improve, we come on to these categories where their flexibility, balance, and coordination is improved. So these are the WHO recommendations. If you want to become physically fit, physically healthy, you should do at least 150 minutes of moderate intensity aerobic activities or 75 minutes of vigorous intensity activities throughout the week, and do some muscle strengthening or resistant activities at least 2 to 3 days per week, and flexibility, balance, and coordination exercises at least 2 to 3 days per week. This is the WHO recommendation. And now we'll see what exercise prescription means. We know that we prescribe medicine, we prescribe drugs, but we do not know that we have to prescribe exercises also. We have to prescribe physical activity also. This is also a prescription. If you tell a person you have to go and do this activity. Now, if a person comes to you, if a patient comes to you, and you think that his maybe aerobic activity has to be improved, you tell him, okay, go and do aerobic activities. Will he be able to do that one? Does he know what aerobic activity means? No. Then, okay, now if you explain that to the patient, saying that you have to do aerobic activities where you do the repetitive activities for a long period of time, how is he going to do? What is the frequency? What is the intensity? So all these things has to be taught to the patient. So we use the FIT VP principle to prescribe exercises. FIT VP means, F means the frequency. How frequently do you have to do these exercises? Is it daily? Is it every other day? Is it twice daily? We have to mention properly. As I said initially, aerobic activities at least 5 days a week. If you can do it at least 7 days a week, that will be the ideal. But if a patient says that, no, I can't do it for 5 days a week, I'll do it for 2 days a week, don't say no. Okay, start by 2 days a week, then gradually improve. And I means intensity, whether this is mild, moderate, or high intensity. T means type, whether it's aerobic, whether it's resistant, whether it's flexibility, whether it's balance, coordination, and balance and coordination exercises. T means time. How long do I have to do the exercises? Is it for half an hour? Is it for 20 minutes? So we have to tell the patient, this is for this amount of time. V means the volume, the total volume of the exercises or the physical activity throughout the week. And P means progression. How are we going to progress? For the first week, this is. For the second week, we have to progress like this. Or are we going to progress with the second week, or are we going to progress it after a month? That of course has to decide with the patient and with the capabilities of the patient and what are the facilities the patient is having. So exercise has to be prescribed. It's not just telling them go and do this exercise. It has to be prescribed in a scientific way. When you prescribe exercise, it has to be always initiated by proper warm-up and ended or stopped by a cool down. So warm-up, in the sense, warm-up means we make our body, make our physical body ready to do the physical activities. So warm-up, we can start with very mild intensity exercise activities, walking, maybe jogging, and there can be dancing, lunges, arm swings, those kind of things in a very mild intensity. Then the time period where you have to do the warm-up can vary from person to person according to their physical fitness. And during this warm-up, they should do light stretching activities Stretching activities also has to be dynamic stretching, not static stretching. Dynamic stretching in the sense you don't hold it for a long period. You go to the level of maximum some discomfort and release it, and go up to the level of discomfort and releasing. Likewise, it's a dynamic thing. When you warm up, make sure that you do dynamic stretchings. And when you cool down, it's the other way around. You have to do static stretching, where you hold it for at least 20 seconds. You stretch it for to the point where you have some amount of discomfort and hold it for 20 seconds. That is static stretching, and you do it when you do cool down or warm down. So all the exercise prescriptions has to be initiated with warm up and warm down, stopped with warm down. So this warm up and warm down time period might vary according to the patient. Ideally, 5 minutes of warming up and 5 minutes of cooling down will be enough for most of the population. But it has to be tailor-made according to the patient's physical fitness. And now I told you about the physical activity and activity recommendations. So if we say that any person is physically inactive, it means that that person is not meeting those recommendations. If a person is physically inactive, that means he's not up to that standard of recommendations. So there's another thing which is called sedentary behavior. These are totally different things. Sedentary behavior in the sense, if a person is not sleeping, he's awake, if he's sitting in a chair or reclined position for a long period of time, then it's called the sedentary behavior. Sedentary behavior is a different risk factor. It's not physical inactivity. It's another risk factor for development of NCDs. So if a person is sedentary for for more than 4 hours at a stretch, then definitely he is having another risk factor which is called the sedentary behavior. If I explain it like this, now there's a person, a doctor, who comes to the hospital early in the morning and starts seeing patients from 8 a.m. to 4 p.m. in a seated position. 8 to 12, he is looking after looking at the patients in a clinic, and 2 to 4 again in a clinic. So throughout the day, at least 6 hours, he is in a seated position. But while going home, he goes to a gym and have a full workout for about 1 hour. Now this doctor is meeting the physical activity recommendations. So ideally, if he does 60 minutes of workout per day, definitely it's more than 30 minutes per day. That's the recommendation. So he's physically active, but he's having a sedentary behavior where he's being seated from 8 to 12 and 2 to 4. So cumulatively 6 hours. So he's having the sedentary behavior risk factor. So this has to be stopped. The recommendation is at least every hour you should get up and do any amount of the physical activity in any intensities, either mild, moderate, high, it doesn't matter, any intensity for a very short period, maybe few seconds. Then his sedentary behavior is changed. So this risk factor will not be there. This is a very serious condition, and we have to definitely start thinking about that one. Even the WHO says limit the amount of time spent by being sedentary and replace with more physical activity of any intensity, including light intensities. So it's always better to get up from your seat every hour and, if possible, move at least 2 or 3 steps away and come back and work again, so that your sedentary behavior will be changed, reduced. Now, up to now, I have been talking about the ways of become physically fit. People who have no chronic diseases. But people with diseases, people with chronic NCDs, what are we going to do? WHO has not given proper guidelines on exercise prescription for people with chronic diseases. But the European Society of Cardiology, they have given for people with cardiology diseases, the cardiac diseases, exercise in patients with cardiovascular diseases. So for them also there are exercise prescription guidelines. The congenital heart disease, cardiomyopathies, heart failure, aortopathy, arrhythmias, for all those patients there are guidelines so that we can prescribe exercise for them. So ideally we have to have a proper diagnosis, then risk stratification, and after discussing with the patient we should prescribe them exercises using these guidelines. So I'm not going to discuss about these guidelines one by one. And even the American College of Sports Medicine, they have also said people with any disease conditions, especially the cardiovascular and pulmonary diseases, they have separate guidelines of prescribing exercises. And metabolic diseases like diabetes, hypertension, metabolic syndrome, those patients have separate guidelines. How are we supposed to give them, how are we supposed to prescribe exercises for them? And for chronic diseases like arthritis, CKDs, cancer and osteoporosis, those patients also have guidelines where we can prescribe exercises for them. This is what the American College of Sports Medicine guideline roughly says. Now suppose there's a patient who does not participate in regular exercises. Now a person comes to you and he says, I don't exercise. I normally do not exercise regularly. So what are you going to do? We can divide them into 3 categories. Now the person does not do any physical activities. He has no known cardiovascular or metabolic or renal diseases, and he is asymptomatic. He has no symptoms of any of those diseases. Then he does not need any kind of a medical clearance from a doctor, and he can start moderate intensity exercises and gradually increase up to vigorous intensity exercises. And there's another person who's a known patient with metabolic disease, renal disease or cardiovascular disease, but he's an asymptomatic patient who has not done any physical activities up to now. Then we say a medical clearance, if we can start doing physical activities after a medical clearance, that will be the best. And after the medical clearance, he can start with light intensity or moderate intensity activities and can progress according to the guidelines. And the other person, there's a person who is diagnosed of having any cardiovascular, metabolic or renal disease, and he's symptomatic. And then definitely medical clearance is a must, and he should start after the medical clearance, he should start mild intensity activities and progress according to the guidelines after discussing with the patient. This is a rough idea where a patient is not a known patient with any regular physical activities, who's not doing physical activities properly. So they are divided into 3 categories, and we can progress with their exercise prescription. And the other category where patients who are doing regular physical exercises. Again, they are divided into 3 categories where no disease and he has no symptom. He has no renal disease, he has no metabolic disease, he has no cardiovascular disease, and he has no symptoms. Then definitely no clearance is necessary. He can continue whatever the activities he has been doing, either moderate intensity or high intensity, and gradually progress. He has no issues because he has been doing regular exercises, he has no disease and he has no symptoms. If a patient is doing regular physical activities, he has either cardiovascular diseases, metabolic diseases or renal diseases, then medical clearance for moderate intensity exercises is not a necessary, it's not a must. But he can do his normal day-to-day activities, but his activities. But to him to go for a high intensity activity, it is best if he can go and have a medical clearance. And patients who are regularly exercising and having some amount of these diseases, either cardiorespiratory disease, metabolic disease or renal disease, and symptomatic, then they should discontinue doing the exercises and they should get a clearance from a physician before going for a physical activities, because he's a diagnosed patient and he's symptomatic. Then even though they have been doing exercises, it can be very risky. So ask them to get clearance properly and do the physical activities. So these guidelines are there for even patients with any chronic diseases. If you want to prescribe exercise for the patients with any chronic disease, you can use these guidelines. Even the WHO does not, though they don't give proper guidelines of how to prescribe exercises, they also say people who are having chronic diseases will benefit from doing the same amount of physical activities as normal adults, and even more than 300 minutes of moderate intensity exercises, more than 150 minutes of high intensity exercises per week. They can have additional benefits. So the WHO, though they don't give proper guidelines of how to do that one, they also recommend for people with chronic diseases, they also should do some amount of physical activities as per normal population. And these are the key 6 messages given by the WHO for the normal population to improve their physical fitness. First one is physical activity is good for hearts, bodies and minds. For every category, it's good for heart, bodies and minds. Any amount of physical activity is better than none, and more is better. As I said initially, any amount of physical activity, though the recommendations are there in moderate intensity or high intensity, any amount of physical activity in any intensity is a very good thing. And if a person is capable of doing mild intensity exercises, maybe for 3 to 4 minutes per day, don't discourage them, encourage them. Okay, we'll start by this intensity and in mild intensity for a short period and gradually increase according to that FIT VP principle. And third one, all physical activity counts. That is also one thing that you have to understand. Now, people might think, now when I am exercising, I have to do at least 10 minutes or 30 minutes of exercises. Now the recommendation is any physical activity counts. If you cumulatively, if you do physical activities, at least moderate intensity high activities throughout the day, cumulatively. In the morning, maybe through 2 to 3 minutes. In the afternoon, again 5 to 10 minutes. Likewise, cumulatively, if you do 30 minutes per day, that is also recommended now. And muscle strengthening benefits everyone. That is the fourth message. Normally, we think that muscle strengthening activities has to be done by the young people, because they are the one who's going for the gym to make their muscle strengthen. But now the recommendation is even adults, old adults, maybe people who are 85 years, they also can benefit from strengthening activities. So they also should do strengthening activities. Even the pregnant women has to do strengthening activities. So the muscle strengthening benefits everyone. That is the fourth message. And the fifth, too much sedentary behavior can be unhealthy. So we have to always reduce our sedentary behavior and make it a minimum, where at least every hour you get up from your chair and do any intensity physical activity for any amount of time and sit down again. And the fifth one is everybody can benefit from increasing physical activity and reducing sedentary behavior. So any amount of physical activity is better than doing nothing. These are my references and I hope you could understand, and I am happy to answer any questions if you have any questions to ask. Thank you very much.
Thank you very much, sir. So we are moving on to the question round. The first question I would like to share with you is what to initiate in doing physical activities for patients with long-term joint pain. And what are the options for elderly people? There's another quite long question that would go with this, sir. Overweight patients with osteoarthritis of knees, how could you prescribe an exercise plan for them? Muscle strengthening exercise for a few months and then begin aerobics exercises. That's the question. That's the whole.
So for any disease condition, definitely there are recommendations. But when it comes to the first question, if a patient is having any joint problem, suppose that the patient is having knee problems, but then if he is having severe pain, what we can do is we can give them upper body exercises where there are no pain. Then we can prescribe them exercises to the joints or the muscle groups where there are no pain. And the other part is if a patient is having arthritis like PTS, we can start them with activities which are mildly painful. What we normally say is a rough idea how I can illustrate that one is now. If you ask them after to have a scale of pain where 0 is they don't have pain and the 10 is the maximum amount of pain. So while they are doing any physical activities, if the pain score is between 1 and 2, it doesn't matter. They can continue doing those physical activities. And as for joint pain people, they might have some amount of increased amount of pain just after the exercises, maybe within 2 hours, but it will go down. So according to the patient, according to the level of the patient, we can decide on doing the exercise. I hope I gave you the answer.
Yes, sir. Thank you. And moving on to the next question, what are evidence available for physical activity in prevention of malignancies?
Malignancies, of course, there are a lot of evidences. I mean, more as I can remember, the most of the evidences are there for colorectal cancers. So people who for prevention also, it's very important because if you start doing physical exercises regularly, colorectal cancer as well as breast cancer, as I can remember, I cannot give you the exact. I don't remember the exact the research article, but there are articles saying that colorectal cancer and as well as breast cancers, they have health benefits. And people who have cancers, chronic cancers, they definitely will improve by doing physical activities. Simply because their physical strength will go up, as well as their mental health will go up.
Okay, thank you, sir. Next question. How to increase physical activity with busy schedules and how a medical officer can arrange such programs for other professionals with busy schedules?
As I said during my lecture also, now initially we thought that we have to have a exercise program at a stretch where at least 30 minutes at a stretch. But now the recommendation, what they say is even a small amount of exercise is important. At least maybe 1 minute, maybe 2 minutes, and cumulative factor is going to be the most important thing at the end of the day. So if one person, I'm sorry that there's a disturbing noise in the background. I'm sorry, I cannot help with that one. And now, even for a busy scheduled person, if he says that I have less amount of time, one thing you can do is to make sure that they don't have a sedentary behavior, to minimize the amount of sedentary behavior. And the other thing is, while at work, we can enlighten them how to become physically active throughout the day. If a person is again, I'll take examples from doctors. Now, if you are in a clinic, if you are seeing patients, and in the clinic, when you see patients, after each patient, why can't you get up from your seat and sit down till the other person comes? You can get up from your seat, and when he sits there, you can sit down. Likewise, you can do very simple things. You can stop using the elevators or the lifts, and start climbing. Likewise, we have to tell them what are the feasible ways after discussing with the patient and the player or whatever the person. We can tell them the simple way of starting their physical activity at maybe at a very low level, but gradually with time they can improve.
Okay, thank you, sir. More questions. Does strenuous exercise and playing badminton do more harm than help? And I'm adding another question to that. What are the best sports for kids?
I will answer the second question. What are the more suitable uh, sports for kids? It depends. Nobody can say which kind of a sport suits you. What we say for kids is to do multiple amount of sports so that they can have an idea what they are capable of, what their talent is. Then when they are about 15, 16, they can specialize on one particular sport. Initially, at small stage, young age, what we say is do multiple sports. Then only they can have an idea which sports they are capable of. For the first question, strenuous exercise. There are people who do competitive sports, high-end competitive sports people. They might have a higher chance of developing injuries. Of course, true. But if you are doing in non-competitive level, you are doing it as a leisure activity, then of course the chances of having injuries is less compared with the people who are not doing any kind of physical activity. So if you are a competitive player where you play for a long period of time, of course you might have a slight amount of risk of developing any musculoskeletal injuries, but it's a price you have to pay in playing at very high end competitive level. But if you are doing it for leisure activity to improve your physical fitness, of course you are safe than rather than having a lot of diseases.
Thank you, sir. More questions. Protein intake with physical activity, does it need to be higher along with the workouts? And there was another
Yes.
question. Sorry, sir. Adding to that, does passive stretching? What's the role of passive stretching?
Yes. For the first question, that when your physical activity level goes up, of course your protein intake has to go up, because simply because when you do any amount of physical activity, there will be muscle breakdown. So to prepare those muscle breakdowns, ideally the protein intake has to go up. But it normally says for a normal person, 1 gram per kilogram body weight protein is enough. But for high-end athlete, it can go up to 1.8 or maybe 2 even. So for the first one, what was the second question? Sorry.
Second question was passive stretching. What is the role of it?
Yeah, passive stretching. Now, passive stretching, when you warm down, passive stretching will be a good thing where somebody helps you to stretch to a point where the discomfort is there, but you have to make sure that you hold it for about maybe 20, at least 20 seconds. Then only the desired relaxation will be there. But when it comes to rehabilitation, of course, there is a very good place in passive stretching.
Thank you, sir. I think you touched on this. There are some questions about existing NCDs and physical activity, specific exercises or rehab post PCI, and I'm adding other questions to that. And regarding non-alcoholic fatty liver disease, and also chronic renal failure, which is physical activity disadvantages, or how should physical activity be done in these instances?
Yeah, all these instances, after PCI, acute PCI, and chronic renal diseases, even there are programs, cardiac rehabilitation programs, where it's divided into three stages. When the patient is involved, of course, they have to start their cardiac rehabilitation, and so definitely they are going to benefit. There are guidelines, and definitely they are going to benefit. even for chronic renal failure patients, uh, when they do not do any kind of physical activity, their muscle strength, muscle endurance, and overall their physical fitness goes down. So they should do regular exercises, but their intensity might change. The way they do the intensity of their physical activity might change according to their levels. So it's an individualized thing, but definitely even patients with chronic renal failure, they are going to benefit.
Right. Thank you, sir. There are many questions. I'm sorry we won't be able to answer all of these. I'm just going to ask you 3 more questions, sir. Will there be any consequences if we do regular physical activities in later life, like overuse of joints and leading to knee replacement?
No, definitely not. But now, if a person who has never done physical activities in later life or in early stages, if they start at a very high level, in high intensity for a long period of time, definitely it's not recommended because it will be very painful the next day, the following day. So what you should do is to start at a lower level and gradually increase to that whatever the recommendation. So if a person start doing physical activities today is going to be the first day. So don't go up to the recommendations where moderate intensity or high intensity exercises for about 150 minutes per week. If you do at that level, then of course you will have a lot of joint pains and problems. But if you start at a very low level, maybe in mild intensity, and for maybe 2 to 3 minutes, and then gradually progress. That's what I said, BP principle. Initially start at a lower level and gradually progress. P means progression. So gradually progress up to the standard. Then there won't be any issues. Of course, for knee replacement, definitely for adult, just by doing physical activity, they will never go to a stage where they have to go for knee replacement.
Okay, thank you very much, sir. What are the parameters seen for medical clearance and who should do it?
Sorry?
What are the parameters seen for medical clearance and who should do it?
Medical clearance, of course, now in Sri Lankan situation, there are laws which says that people who have either the diploma in sports medicine or above, and people who has done there's a 1 day course who has done who's the health ministry is organizing. So people who have that certificate can give the medical clearance for the sports. But as a normal physician, if a person comes to you saying that I want to do physical activities, of course you can recommend. Anybody can who has an idea of the health system can recommend them to say that you can do in mild intensity, start from mild intensity and go up to a higher level. The clearance per se, I'm saying for sports, it's not for the physical activity. People who are engaged in sports, competitive sports, for that clearance to give a clearance for a particular sport, of course, that has to be done by a person who has that qualification from the Ministry of Health. But as a normal physician, if a person comes to you saying that I want to engage in physical activities, it's not sports, it's physical activities, then any physician can prescribe.
Thank you very much, sir. Last question. Can children exercise in the gym?
Yes, even for kids, they can go and exercise in the gym. What they're asking maybe about the weightlifting for kids. It is recommended without any if they don't have any pain, if they are enjoying that time, of course they can use their body weight they don't have to go and do high weightlifting with barbells or dumbbells, but they can use their body weight. And of course, if they do exercises in a weight lesser than their body weight, they can do. No worries.
Thank you very much, sir. Sorry, sir. Okay.
As long as they are enjoying and they don't have any pain.
Right. Thank you very much, sir. So I apologize for any other people who have forwarded questions and if they were not answered, but as we are tight for time, we are going to wind up the session. And before that, I would like to extend our sincere gratitude to Dr. Mithila Ruwange, acting consultant in sports and exercise medicine in the Lady Ridgeway Hospital for Children. Thank you very much, sir.
Thank you very much for inviting me.
Thank you. So before we go, a few more things. Right. Find the link in the chat box for there's a feedback session, feedback form. Please find the link in the chat box, and please kindly give your feedback and answer the post-assessment questions. And you will receive your e-certificate for participation. And if you have not received your e-certificate for participation within 3 days, please kindly inform our Shri Institute. The WhatsApp number is given in the chat box. So that's it. Thank you very much. Hope you all have a great weekend. Hope you all have a great day. Thank you very much once again, sir. Have a nice day.